Welcome to Break Everything. Your host, Lisa Levy, will guide you through critical thought conversations and a journey of directed disruption that makes a difference. Experience bold conversations with industry leaders who are willing to challenge the status quo.
Welcome to today's episode. I want to introduce you to our guest today, Dr. Goel. He has been in practice since 2010, and he is the founder of Desert Mobile Medical. It's a concierge physicians group. Let me say that again. Concierge physicians group based in Scottsdale, Arizona. He grew up in the New York metro area and completed his bachelor's and his master's degree in finance and economics at St. John's University, and then attended medical school in India, where and then completed both his internship and residency at Brookdale University Medical Center in New York. While in residency, he excelled in clinical practice. He's a great listener and has an impeccable bedside manner. Though the insurance-based practice kept him with his computer more than his patients. And that's when he realized there needs to be a better method of healthcare delivery for his patients, and led to the creation of Desert Mobile Medical in 2018. The practice focuses on house calls, allowing for better quality of time and interaction with his patients. Dr. Goel is also a national speaker on health and wellness, a published author, and is fond of teaching the up-and-coming generation of future doctors. He's also a single dad and has an adorable daughter who might make an appearance at the end of this. Dr. Goel, thank you for joining the conversation today.
Thank you, Lisa.
So you started out your life in finance. How does that translate into a career in medicine, and a disruptive one at that?
Wow. So I grew up in a physician family. My dad's a cardiologist, still practices in New York. Growing up, I didn't know what a workaholic was. And so I never wanted to do medicine because I just related what my dad did to being never at home. And so I'd seen the movie Wall Street, and I was like, man, I could retire by the time I'm 30. That sounds very appealing to me.
Greed is good.
Yeah, exactly. I'm a true capitalist at heart. I really believe in the capitalist system. And so, I kind of decided that I wanted to do a major in business and go and work on Wall Street. It wasn't until I tore ligaments in my left knee. It was the recession of 1994, and I subsequently got let go in my position on Wall Street. And my dad was like, "See, son, if you were a doctor, you'd have more business right now." The capitalist mind started working, and I went to go get my surgery done for my torn ligaments in my knee, and fell in love with the orthopedist. I originally went to med school to become an orthopedist.
Interesting, right? So those personal experiences in our life inform and help us find our passion and our direction. And, so it started out with a dad and I told you so moment. Is he a proud papa now?
He is. I can probably share a little bit about that. He was always, his first generation Indian. Coming here, and so for me, had a very strict upbringing. Academics was always on the forefront beyond anything else, and I guess he's stereotypical Indian. Like, if I got a B plus, it was like, why didn't you get an A? And if I got an A, it was, why didn't you get an A plus? And got an A plus, it's like, were you number one in your class? And so with that upbringing, it was hard to please my dad. He did say back in February of 2021 how proud of me he is. This was after he had told me that nobody's going to pay you to come to their house to do medicine.
Oh, he has his signature moments for you, doesn't he?
Yeah, he had told me, he's like, you remember when you were 13, those Air Jordans you wanted? The insurance companies paid for that. They put food on the table. they put a roof over your head. So he was, very old school in his thinking.
And a little skeptical about what you were trying to disrupt and change and make an impact for your patients' experience.
Absolutely. I think we've gone a long way since 2018 when I started the company, and my thought that bringing convenience along with great, exceptional customer service should be on the forefront of your healthcare delivery. I think we've succeeded in being able to provide those two.
When you were starting the idea and formulating, right, the idea of being innovative by kind of going backwards, how did people respond to that? Because your focus is very much on the patient and care and service, old school with tech.
Yeah, I think I never reinvented the wheel. I just shined it up a little bit and added some modern technology. I think people are unaware that in the 1940s, during World War II, there was a wage freeze imposed by the federal government, and that's been the start of the health insurance industry, and how medicine or healthcare delivery was going to be given. And with a third-party system like a health insurance company, they dictated the care early on. They wanted everybody to be in one place, being seen at one place, either a clinic, private practice, or a hospital. It was, the original trend was you were sick, the doctor came to you.
Yeah. And since we first met in the 2018 timeframe, at that point, it was you building the business. You now have two other doctors.
It's four of us total, actually. I just brought another physician on as well.
That's fantastic. So that's growth through the pandemic, which on one hand, for a physician, providing house calls makes a lot of sense. But as we're coming out of the pandemic into recovery, what are some of the challenges that you're facing or your patients are facing and problems that you're solving for them with your practice?
Yeah, when I started in 2018, I never fathomed that there would be we'd be living in a pandemic. You might say recovery, but I've been encountering a lot more in the last 2 weeks of new COVID cases. So it seems like the new variant that's coming out of China might be again rearing its ugly head.
I say recovery and I'm in a hopeful way, right? At some point we have to get there.
Exactly. I think it's one of those things where I think every time there's a new variant, people are caring less and less about it. But to answer your question, I think, prior to the pandemic, it was this mindset, wait, what do? You come to my house? With March of 2020 onwards, we've seen such explosive growth. I don't think anybody wants to go sit in the waiting room with other sick people coughing on them, having to touch non-sterile objects where they might contract something. And I think the knowledge that you and me have, I think, is broad based with the whole population. Everybody's washing their hands. They're more health conscious.
Mhm. With your patients and providing the care, how do you see, are there obstacles on the immediate horizon? Are there opportunities? What are you seeing coming next?
The only obstacle I have is to find the right physician that fits the mold of what we're trying to provide. I'm in talks with a pediatrician right now to bring her on as well, just so we can have all-encompassing care from birth to expiration. Everybody's got an expiration date.
They absolutely do. So because the focus is on your patient in a way that's so different from a traditional practice, what makes an ideal physician for your team? What are different characteristics?
having exceptional bedside manner, I think, is the forefront, not only for our branding, but also for the ease of trust. If you see somebody that's very abrupt or abrasive, your tendency to trust that person, whether it's healthcare or in any other industry, is very diminished. And so, being able to listen to somebody and understand where they're coming from, be relatable, I think is the number one thing that we're looking for. I'm sorry, I think I'm getting a call from the nanny. Give me a second. Um,
No worries. If you need to mute.
Hi, Kelly. Yes, I sent you a text from Carly's. Schools schools closed this Good Friday. I'll send you the address. Okay. I wasn't aware that there were no schools earlier today, so yeah, it was kind of frustrating to find that out because I think I have my head too much involved in my profession sometimes. Sorry about that.
Absolutely no worries. Don't worry about it at all. We will fix it. So we were talking a little bit about and getting ready to talk about the traits, right? The exceptional bedside manner and that interaction with a physician on your team and how that's important. What other aspects? Is there anything else that you'd like to highlight?
I don't think a lot of people know this, but doctors incur a lot of debt, just enormous amounts of debt with the amount of schooling that we have to do. We're not trained to in the business, in any type of business. We're always trained to be good doctors, and so I think a lot of people when they're out of training, they immediately see dollar signs somewhere and follow it, and it's usually a hospital based or a big group that offers them contracts, and their mindsets. I got to pay my bills, I got to pay off my debt, and look at that nice car and the nice house that my neighbors are in. I gotta bump up. It's all about the Joneses. I've been slaved out for so long that I think it's time to enjoy aspects of my life. And so I think having that mindset that money is not the end all. Getting back to why you went to med school, and that was to take care of patients.
Absolutely. So you and I have known each other for a couple of years at this point and knew each other professionally as business owners. And then in early 2020, I, in a panic, called with, oh my God, I'm in the hospital with my 91-year-old grandmother, and I haven't seen a single doctor in like 7 days. Having a place to call for help, a person, an actual human being who is not only real, but is skilled and trained and a medical professional to help walk through the insanity of being in care in a hospital. For her, she was out of state, so her regular physician wasn't here. And in a matter of days, you took on her care.
Absolutely, yeah. I think the paradigm shift in how healthcare is delivered again, being able to see patients same day or next day, based on their schedule, not mine, or the office load, so to say. Most offices have 5,000 to 15, 20,000 patients, and that's why when you call, they're like, "Yeah, we'll see you next month." You have an acute issue. It needs to be dealt today or tomorrow. You can't wait a month. Most of the time people forget or something just, they're like, I can't deal with it in a month, and they forego their health care, and things kind of start to snowball, so to say. And then next thing you know, you land up in the hospital, and hospitals aren't geared to take care of everything. They just want to patch you up and send you back to primary care. Um, it was a delight taking care of you and your family.
So people who know me have heard stories about Granny. She is a part of my video on a regular and ongoing basis and was a huge catalyst for this podcast actually coming into existence. So it sort of started right a couple of years ago with Dr. Goel and the fact that there is a place to go where you can get actual, meaningful, empathetic care. And that is just so lacking in the broader scope of the industry. Before we go down another path, I want to stay with your business for a minute. With Desert Mobile Medical, you are based in Arizona. Is this a practice that you want to scale and take across the country?
I think there's potential. My mindset of what the company um, provides about having a doctor that's, the doctor that you see at your place of worship, at the local restaurant, movie theater, you see him in the park with his kids, you know that person by first name, you have their cell phone number. That's the way medicine should be practiced. You should have, a doctor in every city, every, town, like that. And I think the scalability potential is definitely there.
All right. So hopefully in 2 years from now, there'll be Desert Mobile Medical branches in a couple of different places. Be fun to see that happen.
That'd be wonderful.
That'd be wonderful. All right. I want to go to a topic of conversation where we get to sort of start imagining the future. If I gave you a magic wand, what one thing would you change in the industry? My magic wand is powerful. It removes all constraints, cost, logistics, bureaucracy. All of those things are just gone. If you can, from a green field, create something, what would it be?
Hocus pocus, alakazam. I would get rid of third-party insurance, um, at least at the outpatient level. Obviously, insurance was made for a rainy day when you don't have the money to subsidize a hospitalization or a big surgery. But for outpatient care, I think it's redundant and creates too many hurdles in the care that you should be receiving. Insurance companies today they prior auth everything, and when the doctor says that you should be on this medication and you can't because it's not on their formulary, that creates a hurdle. When they send you for an MRI and the insurance company says no, go and do this, it's in the hopes that you will forego ever getting that MRI. You'll go get the X-ray, then you'll have to go back to the doctor, and the doctor will say, okay, the X-ray didn't show anything. We knew that, but now I got to get a prior auth to get you an MRI. Insurance companies, again, I'm a big believer in capitalism, but for insurance companies that have to provide for their shareholders, the CEO is geared not towards any of his patient population. He's geared to make his shareholders profit so that he can get an even larger salary. And so it doesn't make sense in healthcare. A free market system allows for affordable healthcare at an outpatient level.
One of the things that you do with your practice, and I'm fortunate because I am one of your patients, and so I live the experience. The insurance is not part of the model, and you negotiate with labs, with imaging centers, with the different services that we need to support our care. And you set fees with them, that you pre-negotiated fees. And last year I had an experience where they accidentally tried to bill me the rate that they would have billed my previous insurance company, which was 100 times what you had negotiated the rate to be with them. So with that third party in the middle, pricing transparency and pricing reasonableness, for lack of a better word, doesn't exist anymore.
Insurance price model. For example, a mammogram would be billed out to an insurance company for $1,200. If you have a high deductible plan that's $5,000 and above, which you'll almost never hit if you're healthy and doing well, getting preventative care through primary care, maybe a GYN, you go for your mammogram and the imaging facility sends your bill to the insurance company. The insurance company says, "Oh, this isn't our responsibility." They still have $5,000 of deductible, and so they shift that responsibility onto you. Where in reality, that same mammogram cash pricing would be $100.
Yeah.
And same can be said for MRIs, labs, anything that you would need from a primary care physician.
And we have very little control over what happens. It's infuriating.
They're getting better. Last year, hospitals had to disclose their pricing, and so a price list came out from hospitals. In July of this year, imaging facilities and lab facilities will have to disclose, and I'm presuming shortly thereafter that even private practices and small businesses will have to start disclosing. We've disclosed since 2018. We've been very clear that price transparency, excuse me, should be readily available. There shouldn't be any fudging of the numbers. You shouldn't be, left in the dark as to what you're going to pay. You should know up front.
Absolutely. So in this vision that you have for the future, how would we start through the process of getting there? What are the three things that it takes to go to that free market model and go back to what we once had, maybe even?
I think, doctors are now assuming the responsibility on their shoulders to bring this type of model out and widen its appeal from a doctor standpoint. When I speak to doctors, I think I get them almost salivating when they're like, "Wait a second, I get to create my own schedule, but it's based on what the patient wants, and I get to go back to taking care of patients and not worrying about documentation for billing purposes." And I said, "Yeah, a typical doctor spends 2/3 of their career in front of a computer or on the phone talking to insurance companies, rather than taking care of the patient, which is 1/3 of the pie. They should be spending 95% of the time with the patient and 5% with the computer." I think that's the number one hurdle. Getting more and more people involved with this type of care. Our ex-president, who's no longer in office, had enacted laws to make it easier for concierge and direct primary care physicians to kind of wiggle through the IRS hurdles of what's construed health insurance and what's not. Before that time, we were considered to be offering health insurance on a monthly payment model. So the language has changed from that standpoint, and it's picking up speed at the level of Congress. I think the third is education for patients. That I think the brainwashing of the federal government and health insurance industry has led people to believe that you can use your health insurance card like a credit card. It shouldn't be like that. When you're, God forbid, you're in a tornado and your roof flies off your house, or you get in a car accident, those are the times when you should be using your insurance. But you shouldn't be using your insurance when you need to get your wiper blades fixed, or you got to fill up your gas tank for your car. That's the way health insurance has been set up. Oh, I need a prescription. My health insurance will take care of it. I need an imaging, my health insurance will take care of it. I need to go to primary care, my health insurance will take care of it. It's far cheaper to pay out of pocket for those things.
And it's going to be a significant paradigm shift for patients because we've been trained to rely on our health insurance and expect that that will take care of it. So it's a mindset shift. But once you start to do the math and you start to understand it and see it, it's really easy to get it. But it is a conditioning change that will be required to get past that if we can get the right momentum in that direction.
I think, common sense will dictate, and the free market will dictate. The more and more doctors that are present doing this type of medicine and healthcare delivery, I think will allow people to gain the knowledge that, hey, wait a second, why am I paying so much money out of the nose to get health insurance when all I need is catastrophic portion?
Mm-hmm. You were talking through, your approach and what you do is direct primary care. In industry on a national level, are there more physicians who are going to this type of model? Does it have momentum?
Absolutely. Just on our EMR platform, I think there's 175,000 patients enrolled just on this one EMR. So, it might not sound like a lot when we're talking about a population of 330 million, but it is picking up steam, and in the last 10 years, really, really picking up steam.
Fantastic. Is there anything else you would like to share with the audience about your approach and what you're doing and what it means to them as patients?
I think preventative care should always be on the forefront of any office visit or primary care visit. It's hard for the physician to continue to put Band-Aids on things. It's rather imperative that you take your health seriously and prevent disease from happening in the first place. That's how my practice operates. We've always thought of improving someone's quality of life as being the cornerstone of how we deliver healthcare. And how do I improve somebody's quality of life? How do I let them relax with their family and friends, take vacations, be on the golf course, go to the restaurant, see less of me, be healthy, right?
And right, that should be our goal, right? To have a nice quality of life because we are healthy and we can do whatever it is that we want to do.
Correct.
Absolutely. Well, Dr. Goel, I appreciate you joining the conversation today. What you are building with Desert Mobile Medical is innovative. And for me, I find it refreshing that the innovation is in looking back at how things once were done better than what we're doing today. And there's a cycle to it. And I absolutely love that because everything new isn't always better. And I appreciate your time today. And thank you for participating in a disruptive conversation to make a difference.
I appreciate you having me, Lisa. And I guess I'm the old new.
The old new. Fantastic.
You have just experienced Break Everything with Lisa Levy. Critical conversations on directed disruption that makes a difference.